Hello, this is Amandeep Kaur. Today I am going to present paper on oral health in children. First of all, starting with introduction. During mid 1950s in US, a dental supplier distributed a sign to dentists saying no children under age 13 treated in this office. This sign shows how ignorant people and dentists were in previous decades. Because previously it was considered that primary teeth need not to be restored as they will be replaced by permanent ones. Fortunately, such attitudes and such signs are now gone. So, why maintaining good oral hygiene is important in children? Maintaining oral hygiene in children will prevent development of infections, cavities, and pain. Decayed deciduous teeth may damage the permanent tooth bud developing below deciduous tooth due to abscess or cyst formation. If a child loses a tooth prematurely because of decay, it would lead to space loss. Now, what is space loss? Premature loss of deciduous tooth results in mesial tilting of tooth distal to the extraction space. The lack of space prevents eruption of permanent tooth into its proper position, so resulting in problems like crowding, cross bites, and delayed eruption of permanent tooth. So that's why good oral hygiene is necessary in children. Next is major issues in oral health in children. Early childhood caries, also known as nursing bottle caries, orthodontic problems like cross bites, crowding, and occlusion derangements. Then, dental trauma. It's another most common dental problem among youngers. Fracture, avulsion, displacement are consequences of dental trauma. All these issues are vast topics. Leaving them behind, in this presentation, I will focus on early childhood caries, also known as nursing bottle caries. The presence of one or more decayed, missing, or filled tooth surfaces in any primary tooth in a child under age of 6 years is categorized as early childhood caries. These are known as nursing bottle caries due to faulty nursing practices. Inappropriate use of baby bottle is known cause of early childhood caries, as babies sleep while having bottle in the mouth. This leads to accumulation of milk around teeth, which stays there for longer periods and causing tooth decay. Risk factors of developing early childhood caries. Addition of free sugars to baby bottles, hypoplasia of enamel, oral microflora like Streptococcus mutans, poor maintenance of oral hygiene, prolonged breastfeeding beyond 12 months of age, reduced flow of saliva. All these are risk factors for development of early childhood caries. Next is contributory factors in dental caries. There are 4 major factors which are considered to contribute in caries process. All these factors are interconnected. These factors are host factors, microflora, diet, and time. First of all, host factors. There are 2 of them, tooth factor and saliva. Tooth with more pits and fissures is more prone to caries. And if there is hypoplasia or hypomineralization of enamel, it predisposes tooth to caries. And reduced quantity or more viscous saliva leads to caries. Then microflora. Streptococcus mutant is major bacterial strain responsible for carious lesion. So more Streptococcus mutant in saliva, more chances of tooth decay. Diet. Sticky or acidic diet makes tooth more prone to caries. And last one is time. Amount of time for which food remains on tooth surface is another determining factor for caries process. Now, what is pattern of caries lesion? Early childhood caries follows a distinct pattern of caries development. First affected teeth are maxillary anteriors, followed by pits and fissures of posteriors, and finally interdental surfaces of posteriors. Due to cleansing action of tongue, lower anteriors are least affected in early childhood caries. Next is the size of problem or burden of disease. According to Global Burden of Disease study in 2017, more than 530 million children globally have dental caries of primary teeth. Early childhood caries is becoming more prevalent in low-income nations. How about dental caries in Australia? According to data provided by Australian Institute of Health and Welfare, during 2012 and 2014, proportion of dental caries in primary and permanent dentition rises with age, as children in 12 to 14 years of age group had more number of carious lesion in permanent teeth. Similarly, caries in primary dentition was maximum among 9 to 10 age group. So what are consequences of early childhood caries? Pain and infection is most common problem with early childhood caries. Another one is premature loss of primary tooth. When tooth is grossly decayed and non-restorable, then it needs to be extracted. Effects on speech. During early childhood, child learns to speak, but due to severe destruction of upper front teeth, child may experience developmental delays involving speech articulation and patterns. Psychological effects. Due to bad appearance, child feels embarrassed and tries to hide his teeth. Poor overall health due to functional loss. As teeth become non-functional, child wouldn't be able to chew. Therefore, it leads to digestive problems like constipation, or child may refuse to eat because of pain. All these factors affects overall health of the child. Next is treatment. Fillings, pulpectomy or pulpotomy, restoration with crowns. These are treatment plans for early childhood caries. It's another vast topic, so I am not going in details of treatment. What could be done to prevent early childhood caries? Mothers should clean child's teeth with soft cloth after breastfeeding. Brushing twice a day is necessary. According to pediatric dentists, brushing should be started as soon as first tooth erupts in oral cavity. However, use of toothpastes should be avoided until child learns to spit. Give bottle during meal times only. Don't allow your child to walk around with it or drink from it throughout the day. Limit sugary snacks and drinks as sugar increases chance of tooth decay. Similarly, don't give pacifiers to the child. Teach your child to start drinking from a cup as early as possible, preferably before they turn 1 year of age. Pit and fissure sealants. It's a kind of dental treatment intended to prevent tooth decay. Teeth have recesses on their biting surfaces which are more prone to decay. So pit and fissure sealants are used to fill these recesses to prevent decay. Next is public health implications. Early childhood caries is a disease of children from poor and minority population who have limited access to dental services. Early childhood caries is not only problem for children and their families, but it's a public burden globally as it increases government's expenditure on healthcare. Public health dental clinics gave more emphasis on treating the decayed teeth rather than on prevention of early childhood caries. Conclusion. To sum up, early childhood caries is the major problem affecting oral health of children. It could be prevented by altering dietary patterns of child. Early childhood caries affects psychological and physical health of the child. Therefore, priority should be given to prevent development of early childhood caries by educating the parents. These are the references I used to prepare my presentation. I hope I have presented well. Thank you.